Multiple strategies have been used over the years in an effort to stem HIV infection rates, but organizations providing preventative services to groups such as sex workers and drug users have been met with criticism and sometimes stiff opposition by those who question the morality of such programs. I recently interviewed Dr. Nicholas Muraguri, the director of Global Plan Secretariat, UNAIDS, and PEPFAR, and he talked about the importance of taking the different approaches.
People have tried to bring moralistic approaches to the response. But you always tell people is that we need to look at the epidemiology. How is the disease being spread and among which populations? And quite often, once people understand how the epidemic is playing out in your own country, you soon realize that these so-called groups that you want to avoid, you cannot avoid them. Let me give you an example. In East African states, there are some areas where up to 20% of new HIV infections are attributable to men who have sex with men. In other areas, up to 10% of the new HIV infections are attributable to men who inject drugs, or people who inject drugs, injecting drug users. In other areas, female sex workers play a significant role in HIV transmission in the region. So the more you understand how the disease is being spread in a country, the more you realize that you cannot afford to avoid some of these groups, particularly if they're playing a very significant role in the transmission of the virus within the community. So it's not really a matter of choice. It is the right thing to do. And if you're going to also use a human rights approach, those are people who need services. They have a right to access these services, both for prevention, care, treatment. So the debate of morality is a different issue. We should not be brought into this. We should use science to guide our decision making.
Some will look at it as, in a way, promoting or encouraging people to just continue on what is seen by a segment of society as an acceptable behavior. So how do you answer such a charge?
Studies have been done in the US, here in the US, and even other countries in Europe, has clearly shown that if you have targeted intervention, including needle exchange programs, for example, among injecting drug users, you have a significant impact on HIV transmission among these populations. So it's really science that is guiding this. So, and there's no evidence that if you provide needles to inject drug users, you're likely to promote the behavior. There's no such evidence that shows that. So as we stand now, the scientific evidence we have shows that if you provide needles, a needle exchange program for injected drug users, you stop transmission of HIV significantly among these populations. So it's the science that is guiding us on the right approach.
There have also been issues that are related to antiretrovirus. Someone from Swaziland was telling me that she has lived with HIV virus for a long time. She's on antiretrovirus. She's very healthy. But she feels that sometimes that has been a negative for those who are observing her, that they are encouraged in a way and end up being a little careless because they feel that HIV is no longer that threatening disease. It's containable. Have you kind of discussed that, the positive angle to this, I mean the negative angle to this very positive development?
Overall, the story of people access treatment has been a very positive one. And people understand it like it's a chronic disease now. People understand the risk of transmission. People understand the need to adhere to treatment. So you may find isolated incidences, but overall people understand the disease much better. The network of people living with HIV is very positive. It encourages own members to understand how the drugs work, the importance of following regimens as prescribed by the doctor. Adherence become a very critical issue as part of the way they live. So positive living is a story that's been told everywhere. And that's the story we want to tell the world. Yeah. And people slowly understand that this really is a chronic disease now, just like diabetes. But people know the risk of infecting other people. And in fact, people with HIV/AIDS are playing a significant role in preventing HIV. And that is the story, and that's the position we want everywhere people to follow. So the fact that we have ARVs, I don't think people are complacent at all in terms of how careful they were. And it has been known over generation. The fear factor never helps. It never helps. And that is why the original advertisement or public awareness campaign that was showing thin, dying people with coffins and graveyards, you no longer see that. Because known fear never really drives behavior change. It's a better understanding of what's going on that really makes people change behavior. So fear doesn't really work anymore.
Well, that was Dr. Nicholas Muraguri, the director of the Global Plan Secretariat, UNAIDS, and PEPFAR, speaking with us on In Focus.